know that according to DaVita.com, 1 out of every 10 adult Americans lives with end-stage renal disease. End-stage renal disease is a disease that affects the kidneys. It is also called chronic kidney disease. There are different treatment options for chronic kidney disease. One is peritoneal dialysis, another is hemodialysis, and there's also the option of a transplant. I'm going to speak with you about hemodialysis today. Hemodialysis has a much shorter history than one would assume. The first successful hemodialysis treatment was in 1945. It treated a woman for acute kidney failure, and it saved her life. It wasn't until 1962 that dialysis was able to treat chronic kidney disease chronically. Back then there was a committee that decided who got dialysis and who did not. Most of the time the people that were able to receive hemodialysis were older white males that were able to provide for their families. Today, hemodialysis helps many more people that are not able to get a transplant. Some important parts of hemodialysis are the machines. The machines take over a couple of the functions that the kidneys can no longer do themselves. A couple of those functions are electrolyte and fluid balance that help control blood pressure and help maintain the patient's life. On top of with the machines, there's a dialyzer that helps remove a lot of the fluid and the waste in the patient's body 3 times a week for 3 or 4 hours at a time. Functions that are not able to be treated by the hemodialysis machine are treated by a strict diet and different medications. The diet is a high protein, low phosphorus, low potassium, low sodium, and low fluid diet. The medications that a patient receives while on hemodialysis help build red blood cells and synthesize vitamin D. Another important part of hemodialysis is the blood supply access. There are temporary options and permanent options for blood supplies. The temporary option is a catheter that's usually inserted in the jugular vein and hangs about right here. It has 2 ports, one that removes the blood from the patient, cleans the blood in the machine, and returns it back into the patient through the other port. A more permanent option with a higher or with a less mortality rate is either a fistula or a graft. Those are usually placed in the arm, and the fistula takes about 6 weeks to mature after it's placed. How it is formed is by combining an artery and a vein together, and it matures enough for a patient to be stuck 3 times a week. And it also helps with the needle. You put a needle in their fistula, it pulls the blood out and pushes back in the clean blood. The other permanent access I mentioned was a graft. The graft is made out of synthetic material, and it is less recommended because of its non-native ingredients and because it has a higher instance of clotting. I recently interviewed a patient on hemodialysis that had been on hemodialysis for almost 12 years. That is a pretty high number for a patient on dialysis. This patient explained to me how it changed his entire life when he started hemodialysis. Coming to hemodialysis 3 times a week was pretty much like having a full-time job for him. And the diet is very strict, and it's very hard for him to comply with all of these new things that are in his life. But for the last 12 years, he's been able to do it because of hemodialysis. In conclusion, I just would like you to know that hemodialysis saves lives every day, and that it is a great option for patients with chronic kidney disease. And thank you so much for your time.